now to your health and living well. Today we're talking about the very important topic of hormone replacement therapy.
Dr. Dan Hale is the owner of HRC Medical to talk about what you need to know before you think about hormone replacement therapy. It's such a pleasure to have you here, Dr. Hale, because this is such a hot topic. I hear people talking about it all the time.
Right.
Tell us a little bit about what this is.
Sure. Bioidentical hormone replacement therapy. Understand that bioidentical hormone replacement therapy is different than synthetic. Synthetic hormones are the bad kind that causes breast cancer, cervical cancer, so many bad things that we've heard about in the past. But in contrast, the bioidentical hormones are biologically identical to the hormones that you had when you were younger. Molecule for molecule. They are not synthetic. And it means that you don't have the side effects you do with the bad kind.
So why would someone need to take, or what stage would someone want to consider taking a hormone replacement?
What we're looking for is tiredness. When you get up tired, you go to bed tired, decreased sex drive, putting on weight around the belly and around the butt, and we don't know why. A lot of women, when they've had a hysterectomy, not a lot, all of them, when they've had a hysterectomy, it's going to affect their hormones. But understand, men also, men and women lose 1 to 2% of their muscle mass per year after age 30. And so there again, they don't have the power that they used to have. They don't have the sex drive, erectile dysfunction. Also with mental clarity, depression. So many times women and men too will go to a doctor and they'll have certain symptoms that we're talking about, and the doctor will say, well, it sounds like you have depression. Here's a prescription for Lexapro or Prozac or Paxil, and there was 118 million prescriptions written for antidepressants last year. I believe most of them are for the wrong reason. I believe if the doctor had just checked their hormones, just thought, well, maybe they have a hormone problem, they would have found the real problem instead of covering up with antidepressants that have so many side effects like weight gain, decreased sex drive, and lack of orgasm. All those things are related to the antidepressants. So many women are on those. They shouldn't be. They need to have their hormones checked.
Wow, it sounds like it could make an amazing difference for both men and women.
I promise you, every day in my office, people come in and every day, this has changed my life, this has saved my marriage, I've lost weight, I've gotten off my medication. Had a patient just last week in one of our offices. She said, I was on 6 different medications, and she said, I had to keep a list of how to take all these medicines. She said, now I don't take any of them. All I do is just balance my hormones.
Wow. And how do you do that? Because this is a really interesting process. It's not a cream, it's not a pill, it's not an injection. It's very different, but really important kind of delivery.
It's important to understand the delivery system. There are bioidentical hormones that are creams that you can rub on, shots and pills you can take. What we use is a tiny little pellet that's just inserted barely underneath the skin, usually in the upper outer quarter of the buttocks. We numb a little spot, make a tiny little puncture hole, slide the pellet through, and the pellet lasts for 3.5 to 4 months. It gradually dissolves. Now, the reason why this is so important is because the other kind of bioidentical hormones, they last for a few hours, maybe 8, 10, 12 hours, they're gone. So every day, you're doing this all the time. But with the bioidentical hormone pellets, they last for 3.5, 4 months, which means the hormone is in your system 24 hours a day, 7 days a week. And that's physiologic as opposed to the ups and downs that you experience with the other kind.
That is amazing. So what happens naturally in our bodies that makes us lose this really good hormone that we have when we're younger?
Sure. The ovaries produce 3 different hormones. They produce testosterone, estradiol, and progesterone. As the ovaries begin to fail, then each one of those begins dropping off. One of the first ones to go is testosterone. That's the tiredness and the weight gain, decreased sex drive. The next one drops off is progesterone. That's where we don't rest good at night, have restless leg syndrome, have anxiety, stress, depression. And the third one that drops off is estradiol. That's where we start having the hot flashes, the night sweats, and the vaginal dryness. So each one of those kind of functions differently, but they're produced by the ovaries. Of course, the testicles produce primarily the testosterone in men.
Okay, so if someone is interested in getting in touch with your clinic, you've made it very easy for us. We don't need a referral.
No.
We can actually just make a phone call and come in for an evaluation that includes that really important blood test.
Exactly right, yeah. So, and that's the contrast also you need to understand. So many times people are treated with hormones and they don't even know what the concentration is. They don't know what their deficiency is. It's not just one hormone. It's a balance of all 3 of those important hormones. And if you draw blood, you can tell. All you have to do is just hrcmedical.com, call the number on the screen.
Okay.
Be glad to talk with you.
And so you have a clinic here, you have one in Detroit, and you're fast growing in other areas as well, because I know that you're making a difference in so many people's lives.
We love doing it.
Yeah, thank you for coming on today.
A really interesting topic, very confusing, but you've really, just in this short conversation, you've answered a lot of questions that I know I have had, and I'm sure that visitors
You can go to the website, and you can, and there'll be many other that we have a large website. We talk about it all the time, so you can learn a lot about it.
Great.
Very interesting.
Thank you so much. Thanks for being with us today.
We'll be right back.